झाले बोलू का मग
प्रेझेंटेशन ओपन करा स्लाइड शो चालू करा
स्लाइड शो हाच आहे सर
3 नंबरला तिथं आहे बघा स्लाइड शोचा वर तुमचं प्रेझेंटेशनला F5 की प्रेस करा F5 वर आहे बघा फर्स्ट F5 नाही वर F5
हे ना
F5 नाही F5 तर कसं होतं मी येतोय त्याच्यात सगळे तुम्ही चालू करा तुमचं इथं समोर बघू
ओपन करायचं ना
नाही काय गरज नाही तुमचं तुम्ही चालू करायचं
हॅलो आय एम डॉक्टर R.K. Dawale, MSc PhD, Associate Professor, Department of Zoology, DBF Dayanand College of Arts and Science. I am taking an endocrine gland, that is thyroid gland. In introduction, the thyroid gland is nothing but a ductless endocrine gland situated in the anterior front portion of the neck. It is roughly resembles that shape of butterfly or H-shaped. It is also one of the largest endocrine gland, weighing an average of 25 to 30 milligrams in weight. This gland has 2 lobes on either side of the trachea, which each lobe contains 4 to 6 centimeters in length and 1.3 to 1.8 centimeters in width. The primary function of thyroid gland is to secrete the hormones, namely triiodothyronine, that is T3, and thyroxine hormone T4. Both T3 and T4 hormones play an important role and affects almost every tissue in the body. See the picture of this gland. It is a butterfly shaped, joined by an isthmus. It shows 2 lobes. This is second figure, that is internal structure of thyroid gland. Then we'll see the hormones. There are 2 thyroid hormones, T4, that is thyroxine, that is tetraiodothyronine. Thyroxine is a hormone secreted by the thyroid gland in the blood. It then travels to organs such as kidneys, livers, and gets converted into active form, that is a thyroiodothyronine or triiodothyronine. Then second hormone, that is T3 hormone or triiodothyronine. It is a thyroid hormone that affects physiological processes such as growth, development, and metabolism, etc. The symptoms of thyroid gland. Sometimes symptoms of thyroid gland are the disorders. This is because there are various other factors that can induce similar symptoms, and usually the treatment is given according to the symptoms. For instance, excessive tiredness may be associated when sleep, apnea, narcolepsy, etc. But the underlying symptoms may be equally by the thyroid related. Some of the common symptoms of the thyroid gland are as follows: necrosis, poor concentration and knowledge retention, change in the menstrual cycle in case of females, increased heart rate both in male and female, muscle ache, weight gain, high level of cholesterol. Then thyroid gland disorders. The thyroid gland is susceptible to many disorders and diseases. These problems might be due to the excess secretion of hormones, unusual growth of gland, malignant limbs, etc. Also found. Stress may be actually aggravated the underlying thyroid conditions. Some of the common thyroid problems are as, for example, goiter. It is an excessive enlargement of the thyroid gland often obstructing the esophagus or the organs in the neck region and chest by causing difficulty to eat and breathe. Then thyroid cancer. It is a very common form of cancer. However, the chances of survival for a thyroid cancer patients are quite high compared to the forms of cancer. There are 4 types of thyroid cancers as follows: papillary thyroid cancer, follicular thyroid cancer, medullary thyroid cancer, and anaphylaxis thyroid cancer. Then hyperthyroidism. This condition is caused when thyroid gland excessively produces the hormones called thyroxine. The symptoms includes a change in appetite, unexpected weight loss, insomnia, fatigue, irritability, frequent urination, increased sweating, and heart intolerance. But this condition usually resolves within a few months of a relevant treatment and proper medication. Then hypothyroidism. This condition is caused by the under secretion, low secretion of the thyroid hormone. It is a very common problem and often stays undetected for years. One of the main reasons that triggers hypothyroidism is an autoimmune disorder called Hashimoto disease. In this condition, the antibodies produced by the body attack the thyroid gland, and this results in the glands producing fewer hormones. Then cretinism. Cretinism refers to the congenital hypothyroidism or underactivity of thyroid gland during early childhood, leading to the stunted growth and mental retardation. The term cretin was derived from French word cretin, literally meaning cretin or crest-like, as the disease were mentally retarded and incapable of doing things. It is the iodine deficiency disorder associated with insufficient thyroid hormone occurring during fetal, infant, or childhood phases. It is either due to extreme iodine deficiency, that is endemic cretinism, or due to decreased synthesis of thyroid hormone, that is sporadic cretinism. It is typically diagnosed during infancy or in childhood. However, the best preventive strategy is the screening of neonates. It is important to diagnose and treat cretinism early. A delay may lead to irreversible damage. Replacement of hormone will be produce an immediate effect. Then cretinism symptoms. Generally characterized by the stunted growth and mental retardation. It shows dwarfism or short stature, mild neurological impairment with reduced muscles and coordination, hearing and speech defects, unable to maintain posture and balance with the characteristics walking style, myxedema, enlargement of thyroid gland, that is goiter, and the sparseness of hair in case of nails. Voice be deep and hoarse, retardation of sexual attributes, thickening of skin, as shown in the figure we can see, enlarged tongue, protruded abdomen, umbilical hernia, delayed tendon reflex, and decreased intelligence, that's IQ. Then next syndrome is myxedemous cretinism. It is characterized by following conditions. It shows retarded growth, incomplete maturation of facial expressions, thickened and dry skin, small and dry hairs, eyelashes and eyebrows, mental retardation of comparatively lesser intensity to neurological cretinism, delayed sexual maturation. Other clinical manifestations of hypothyroidism. Then we'll see the treatment on thyroid. The most common treatment is available for thyroid problems like hyperthyroidism is to replace thyroxine with another synthetic man-made hormone called levothyroxine. It is a artificial hormone or L-thyroxine. It is an injectable and an oral medication that can return the balance of the thyroid gland. Patients will experience a reduction in the symptoms of thyroidism in a few weeks post medication. Cancer in thyroid gland could be treated quite successfully with radiations. Thyroid cancer would be difficult to diagnose sometimes as it shows no signs or symptoms. A periodic checkup is essential for preventing such diseases from the taking roots. Then treatment on cretinism. Once diagnosed, treatment should be started within 1 to 2 weeks of life. Treatment should be started before the onset of symptoms. If developmental abnormalities and mental retardation starts to appear, it will not be reversed even with the thyroid hormone replacement therapy. The recommended dose is 10 to 15 μg per kg of the body weight. The dose should be increased as the age. Everyday treatment with the thyroxine should be initiated as early as possible, as mental retardation that has ensured already in only a particular reversible. With early treatment, physical development and growth can be reversed and mental retardation can be checked out. There has been to be some of the mechanism that regularly, very carefully, the amount of T3 and T4 secreted by the thyroid gland so that the normal amount of the manufactured and delivered into bloodstreams. The mechanism is very similar to that which regulates the central heating in a hours when there is a thermostat. In case of thyroids, the thermostat consists of a little gland that is called pituitary gland that lies underneath our brain, in our skull. The pituitary senses the levels of thyroid gland hormone releases in the bloodstream, just the thermostat in our living life. Under normal circumstances, if the level drops just a little below normal, the pituitary reacts by secreting a hormone called thyroid stimulating hormone, that is called TSH, and this hormone is activated by the thyroid gland to put more T3 and T4 hormones. Conversely, when the thyroid hormone level rises above normal, the thermostat seems this and the pituitary stops secreting TSH so that thyroid gland stops working so hard and secretion of T3 and T4 is reduced. Thank you. Hello. Sir?